This presentation is being presented in response to the research done on the use of telemonitoring to prevent rehospitalizations in congestive heart failure patients in the home care setting. The purpose of the project is to decrease the number of unplanned hospitalizations in congestive heart failure patients by using the best evidence to change the current standards of assessment in education, which do not currently require the use of telemonitoring in all CHF patients at Lifetime Home Care. According to DeSalle and Stevenson, heart failure causes the majority of hospitalizations of adults over 65 within the United States. More than 1 million patients are hospitalized with heart failure, which costs more than $17 billion in Medicare expenses. Because of these costs and the fact that within 6 months of discharge, more than 50% of CHF patients will be readmitted, pay-for-performance initiatives under the Affordable Care Act have been established to reduce costs and to improve quality of care. According to Zuckerman, between April 2010 and May 2015, approximately 565,000 unplanned hospitalizations were prevented across all medical conditions since the Affordable Care Act was started in 2009. Lifetime Home Care Agency is driven by Medicare guidelines and does not get paid when patients end up readmitted to the hospital when it could have been prevented. Because of this, Lifetime Home Care currently uses OASIS questions in the assessments to assess the risk of rehospitalization, and then creates care plans, which as of right now seldom include telemonitoring services. Background questions regarding this problem are: does the use of telemed in CHF home care patients result in less rehospitalizations? Does monitoring the patient's weight and vitals daily, as opposed to weekly, decrease the number of rehospitalizations? Are nurses able to intervene sooner with the use of telemed in CHF patients? The PICO question is: P. When taking care of CHF home care patients, I. Will the use of telemed services in the home, C. As opposed to not using telemed services and only receiving standard home care visits, O. Result in fewer percentage of hospital readmissions within 6 months of care? Based on this question, a 9-step approach was taken to search for credible research on the benefits of the use of telemonitoring in CHF patients. The databases searched were CINAHL, Nursing Reference Center Plus, and PubMed. Keywords used in formulating the search were telemonitoring, telemed, congestive heart failure, and hospital readmission. Inclusion criteria and limitations posed in the search were dates between 2011 and 2016, humans, English, research, scholarly, research article, and journal article. The number of articles initially retrieved were 170. Used was exclusion criteria greater than level 3 to ensure that the articles retained were appropriate. 5 of these relevant articles were used. An additional search method used was the UB Library database search, along with formulating a search history table as displayed here. As you can see, this table breaks down the steps of the search process. From the articles chosen, a table of evidence was created. The table here displays the study citation and the authors, the sample characteristic size, the design, patient, and selection, the intervention, findings and conclusions, the level of evidence of the article, and the comments and strengths I found from the article. Based on the substantial review of systematic reviews and meta-analysis reviews, impacts of telemonitoring in congestive heart failure patients is still a growing concept and further research and review needs to be done. Based on the findings of the 5 systematic reviews, which in total included 105 reviewed studies, the impact of telemonitoring is variable and undetermined in many cases. However, with there being no risks and cost effectiveness, it is recommended to CHF patients, which will increase their awareness of their disease process and allows patients to be active in their care, which can in turn decrease mortality and rehospitalization rates. The recommendation based on the review are to assess CHF patients who may benefit and comply with telemonitoring and to coordinate this for their plan of care. There are still gaps and inconclusive results within the research to determine the positive outcomes of telemonitoring in home care. However, studies have showed that the use of telemonitoring among CHF patients can decrease mortality, decrease hospitalizations, and is cost effective. In relation to the inconclusiveness, it shows that conducting a study to determine effectiveness may require the Evidence-Based Practice Committee to seek and gain IRB approval. The plan for implementing the telemonitoring protocol for CHF patients in the Lifetime Home Care Agency will be done following the Stettler model. The preparation phase will be making the purpose of the protocol clear. The staff will meet at one of the 3 organized meetings that will be set at different times to meet different nurses' schedules. Following these meetings, they will have a good understanding that patients with CHF who use the telemonitoring system will have less mortality rates, less hospitalizations, and that the use of telemonitoring is cost-effective for the agency. The staff will be educated on the cost of hospital readmissions in CHF patients and the impact on the agency, along with the great number of statistical occurrences of CHF patients being rehospitalized in the mortality rate. Following this education, nurses will be educated on the benefits that telemonitoring can provide to their patients. The staff will also be reminded that telemonitoring units have already been purchased and are available to use, therefore, the cost of the intervention will have no impact on the agency. The validation phase would then be initiated, which goes through the evidence discovered in organizing the information, such as creating a table of evidence, which you saw a couple slides back. Following the second phase is the comparative evaluation decision-making phase. During this phase, meaning will be made from all the evidence, and it will determine if the research was reliable and if there is enough evidence in order to continue implementing the protocol. The 4th phase is when the protocol will be implemented into the practice. This will be done by setting the protocol that every patient with CHF will be assessed for the ability to use telemonitoring and will be set up with the telemonitoring in their home as it is able, while being open to skilled nursing. The final phase for the implementation of the protocol would be to evaluate the outcomes, which would be done by a 30-day review of the CHF patients to determine if there were any unplanned hospitalizations within the last 30 days, and if so, determining ways it could have been avoided. In order to evaluate the practice change, there will be a form found under the originals folder of all skilled nurses' computers that will be filled out every 30 days of a CHF patient's cert period and emailed to the Team Case Assist. This form will simply ask if there were any unplanned hospitalizations within the last 30 days of care, and if there were, what suggestions are there to how this could have been avoided, along with a question asking if an intervention was performed through the use of telemonitoring system that kept the patient from being hospitalized within the past 30 days. The TCA will then keep a file in Excel spreadsheet of the results to monitor for a possible change or impact on rehospitalizations in CHF patients through the use of telemonitoring, which will be sent to all skilled nurses every month in order to keep all staff included. The data will determine if the protocol has worked and will determine possible suggestions for future practice. To sustain the practice change, staff will need to be excited about the change. have an increasing knowledge of the negative consequences re-hospitalizations can have on the agency, and keeping the staff informed and rewarding the staff for positive outcomes. Because telemonitoring is already available, no outside resources or additional costs will be needed to implement this practice. The resources used for the plan of the CHF telemonitoring protocol are the 5 systematic reviewed studies, which have reliable, evidence-based research that determine telemonitoring can be cost-effective, decrease the risk for rehospitalizations, and decrease mortality rates among congestive heart failure patients. All systematic reviews analyzed have the highest level of evidence and are reputable sources. These resources will be made easily accessed and made available by all staff throughout the originals folders on all skilled nurses' computers for further in-depth research, and will be incorporated into the implementation of the new protocol and policy within the Lifetime Home Care Agency. The practice change of the use of telemonitoring for all CHF patients, as opposed to just some CHF patients, will be incorporated into a regular organizational activity and will continue to be a standard policy as evidence shows it is cost-effective, decreases mortality, and decreases the risk of rehospitalizations in CHF patients. This brings us to the conclusion of this presentation. I encourage you to take this information and have an understanding of the positive impacts telemonitoring can have on CHF patients, and share this information with fellow nurses, even if your specialty is not in home care. Thank you for taking your time to watch this presentation.